What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Solar Eclipse edition of the Pandemic Update for Monday, April 8th. 2024. That's right, today was the solar eclipse, and I hope you got to see it safely if you were in the path of it, or maybe you saw a partial eclipse. Hopefully you done so safely. We're going to take a look at a lot of areas that likely were not safe. I mean, yes, it's one of those once in a lifetime. Well, we won't see it again for 20 years, but it's one of those things that are just remarkable. If you get the chance to see it, it's fantastic, but there were a lot of places that were really crowded, and of course we're still in pandemic times, so we have to be concerned. Is this going to lead to some spread of COVID? You know, the old domino effect. First off, if you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. We've been talking a lot about bird flu lately. There's a little bit about that we will talk about today as well. Subscribe down below to stay informed, to help keep yourself and others safe. Of course, like these videos, if give them a thumbs up if you like what you see here, and leave a comment down below if there's anything that you would like to say. The more likes, comments, shares we get, yes, the share button as well, the more YouTube pushes this out through the algorithm. All right, starting off today, we have to start off with the weekly B&O update. Then we're going to take a look at something else. Then we're going to do a little bit of something out of the ordinary that we don't normally do, but you'll see it's going to make a lot of sense because the eclipse strolled big crowd. So we're going to do some stuff in relation to the eclipse, and then we're just going to look at some of the daily data. I don't have a lot of news for you today, so there is that. B&O's weekly update. It's not terrible. New cases, 74,260. The average is down by 18,000 to 95,774. States reporting, 50 out of 50, but you'll see it's not really all 50 states. In the hospital, 9,285. That is down by 1,000. In the ICU, up by 5 once again. Didn't that go up a little bit last week as well? I think it did. 1,407. New deaths, 905. That's right. We finally have a week below 1,000 for the first time since going all the way back to late last summer. The average, though, is still 1,134. That is down by 188. And the new deaths, they should continue to drop because we're not seeing a national surge yet. Scrolling down here, the breakdown for this week's case numbers. Reports are from 22 states. Estimates are from 28 states. Today's total cases is down 13%. COVID indicators are still declining across the U.S., similar to the same period last year. The trend is expected to continue until a new wave begins. And nationally, personally, I'm not expecting a new wave nationally, but I think there's going to be localized areas that see maybe an increase in wastewater soon. We'll get to that and why when we get to looking at the traffic leaving these areas from the eclipse in just a moment. During the past week, 8,015 Americans were hospitalized with COVID, down 15% from the week before. More than 9,000 people are currently hospitalized. Yeah, new deaths, 905. This is the first time it's been below 1,000 since September of 2023. This is the 38th week in a row with more than 500 new deaths in the U.S., nearly 55,000 deaths during the same period. Okay, you might want to say they're looking for something to say a long period, maybe milking it out, but 500 deaths or more in a week, that's still quite a few deaths, so we'll go along with it. So far this year, nearly 3 million COVID cases have been reported in the U.S., causing 251,851 hospitalizations and 25,311 COVID deaths already this year in the U.S. But we have to look at something else from the B&O. And this is a little, just slightly concerning at this point. No reason to cause alarm, but something I don't like to read. This is from B&O News. They're reporting on the CDC. CDC tells state health officials to prepare for human cases of H5N1 bird flu, but says the risk to the public remains low. Where have we heard that before? Yes, we've heard this before with the COVID pandemic, and we know what happened. Do I think there could be more human cases this year? Yes, I most certainly do. Do I think it's going to lead to a pandemic this year? I'm not going to say yes or no. Again, I think this is just something we continue to have to watch. As it evolves, we'll learn more. Right now, we don't know much. And around the world, the history with H5N1, there have not been nearly enough human cases to know what the actual death rate is because there have been so few cases. The current death rate for it is actually relatively high. So as more cases evolve, we'll get a better understanding what the death rate is, what the hospitalization rate is, just what the heck can this do to humans. And, I mean, unfortunately, the only way to really learn more about this is to get more human cases, which is something we don't want, because we don't want it to go human-to-human transmission, but it would be nice if we had more answers as to just what the future holds for this. So, hopefully it does not go human-to-human, but again, it's something we're watching, and last year there was a rise of it in the spring. Last year there was a scare of it in the spring. And right now, that looks to be what is happening, and hopefully eventually it will blow over. Then we'll have to deal with it again next spring. But, we'll just take it day by day at this point. Moving on to this. Quick takes. U.S. measles cases top 100. The EU extends polio emergency. That's right. They're increasing their outlook for polio. They're a little bit more concerned about it, but what I wanted to give you, the key takeaway here is there have now been over 100 measles cases in the United States, raising the national total to 113, so it's something that continues to be a problem. And polio continues to be a problem as well, as the CDC emergency committee met for the 38th time, and they're going to keep that emergency going. All right, let's talk about the eclipse for a few minutes now. This was, I believe, in Niagara Falls. Take a look at this. Now, the eclipse, it's an amazing thing. It's a stunning thing to watch. If you got to experience it in person in a safe area, congratulations to you. But you see here, not all areas are safe. I get it. Someone's going to say, oh, it's outdoors, COVID's over, blah, blah, blah. No, even in 2024, getting together in large gatherings, close together, maskless outdoors, it's not the safest thing in the world, and you have to think outside the box, which I always think outside the box. How did you get there? Are you all going to gas up? Are you going to need to take a rest on your way home? Yeah, let's take a look at that. So, a lot of people went to the different places in the eclipse. Here's the map, the traffic map. You can see the eclipse. It went from Texas. It went something like this, across the midsections of the country, across Ohio. Cleveland was the most populated city, I believe, to be in the path, but obviously that may not even have been the case. Some of these cities these towns grew so large during the eclipse that it was just unbelievable. Take a look here. Here's Missouri. Look at the traffic on these roads. People are going to have to stop at rest areas to use the bathroom from being stuck in dozens and dozens of miles of traffic. And that is going to lead to potential cases because, all walks of life travel through rest areas. People had to stay at hotels. People stayed at different places. Campsites were full. Don't expect a lot of spread from campsites, but hey, packed hotels. Let's take a look at my state. Here's Interstate 79, leaving Erie, Pennsylvania. They were expecting something about 200,000 people in the Erie area, and let me tell you, I think they got it. Interstate 79, look at this. At one point, I checked a little bit ago, it was a 60-mile delay. Now, it's not a 60-mile delay anymore, but take a look here. I can show you the traffic cameras. And again, just picture yourself being in this, and you have to stop at a rest area. Here's a camera right here. And let's see if we can get this streaming. You can see here. It's just sea of traffic leaving these areas. Here's another camera on Interstate 79. Again, it's just a sea of traffic leaving places that saw the eclipse. And I can only imagine where they were all gathered, how crowded it was close together. And again, I'm not trying to downplay the eclipse. It's a fantastic thing to see if you got to see it. But, people patronized in businesses and towns. People stayed at hotels, so, I mean, there could be COVID spread in the communities. There could be COVID spread when they take it back home. Maybe they're going to go back to school. Maybe they're going to go back to the office. You get where I'm coming from here, and it continued up in New York State. I mean, let's go back to Google Maps for a second. New York State. Look, here's the Northway. If you've ever been up to upstate New York or New England, 87 north of Albany, it's called the Northway. Take a look at this. I mean, look at these crowds. These small little towns doubled, tripled, quadrupled in size, or I mean, thousands and thousands of people, and now they're all going home. And again, they'll probably eventually come down here to the thruway, which has a lot of rest areas, and they're going to be very crowded. Let's go up to little old Vermont. Vermont was not so little for the eclipse, and we're going to be taking a look at wastewater sites throughout the week along these paths. Probably more so New England because there's more sites, but we'll also take a look, if we can, on wastewater scan out in the Midwest or the central regions as well. Look at Vermont. Here's Interstate 89. This never happens. Vermont has just over 600,000 population. You're looking at traffic jams that would be comparable to New York City, Connecticut, California, Los Angeles area. Yeah, you get where I'm coming from here. These towns got very crowded for the eclipse. Let's take another look at it here. You can see this is something you don't normally see. Let's see, that's not a good camera to look at. All right, here's one right here. Hopefully we can see. See? Look at this. Just miles and miles of traffic full of people leaving this area. And you can see here, Stowe, Vermont. It's a small little town. Let's see what happened there. Well, if we zoom into Stowe, Vermont, where did Stowe go? Here it is, right here. Take a look at this. Yes, small little town like that, you have to start concerning yourself because COVID is just not going to be among the tourists. It could also potentially spread among the locals as well, which is oftentimes what happens up in college towns. Look at this. This is just absolute insanity. If anyone does not think there's going to be COVID spread from this, I got news for you. It's coming. Hopefully, if you went to this, you done it so safely. All right, moving on. We take a long enough look at that. I have to show you this now. 718 EMS calls in Philadelphia yesterday. But if you did not see earlier today, I posted a quick, I guess it was about 45 second clip. I saw something I never saw happen before today. And I suppose it can happen, but it probably happens more frequently in the COVID times. An ambulance was leaving Abington Memorial Hospital. Another ambulance was going northbound on Route 611 here in southeast Pennsylvania. Well, both had their lights and sirens on, and the ambulance that was leaving the hospital had just discharged patients. Already they were en route to the next call. Who has the right of way? I mean, both ambulances were trying to cross each other's path at the same time. Eventually, one just wins. But yeah, that's a sign of the times. And at that time, there were, I believe, 24 active calls in Montgomery County. Let's take a look. Much better now. It's down to 9 calls. It was a little busy just a short while ago in Chester County at the 5 o'clock hour. That has calmed down a little bit at this time. All right, let's take a look at just a couple wastewater sites. Just going to do, I think, 2. And I do want to take a look. Let's refresh this first. I do want to take a look at the West Coast because we just did all that attention to the path of the eclipse. We got to include the West Coast as well. We'll be looking at more wastewater sites in the east later in the week. Let's see what's going on up in San Francisco. Let's go up to the Oceanside wastewater site. Last time we did southeast side, and look at this. Oh, surprise, surprise. We're starting to see a rise once again in San Francisco for COVID. But if you take note here, we're seeing a rise for RSV, slight rise for influenza A, influenza B, HMPV. Norovirus is not doing this, so maybe it's legitimate, but sometimes when something rises, all the data rises. There's definitely a few glitches to be worked out with wastewater scan. No Mpox at this time, so that is good to see. And there are some detections of hepatitis A at this time. Let's go over to Las Vegas, shall we? We'll just take a quick ride over to Nevada and see what's going on there. And in Nevada, you will notice that COVID levels, they're low at this time. RSV is medium, and it is dropping. Slight rise for influenza A, slight rise for influenza B. Actually, a little bit more significant than influenza A. HMPV, not much of an issue. Norovirus was dropping. Most recent update shows a slight rise. Mpox, no issues at this time. And hepatitis A. There are some detections of that at this time. Let's take a look at a little bit of CDC data. Hospital admissions in the past week, 8,015. The change is down 15%, and that's a good thing. We'll have to watch in the path of totality to see if there's any hospital increases, because again, remember, let's go back to this yet again. Remember, it's not all just people returning back to their communities. People patronized in businesses. Businesses were likely packed in the path of this total eclipse. So there is going to be community spread in these communities as well. And then, of course, you're going to have spread that gets brought back to the towns. Like, for example, we didn't talk about this. Look at Chicago. Look at Interstate 65. It's just a sea of traffic. You can see here red, yellow, going back to Chicago. Well, say Jimmy and his family went to see the solar eclipse. Well, Jimmy's now headed home. And his family, the kids are going to go back to school. Jimmy's going to go back to work. Well, say he caught COVID. Well, now he spread it to the office. The kids spread it to the school. So now there's going to be outbreaks in schools, outbreaks in offices. Get where I'm coming from here? It is something to be concerned about, even though it is such a memorable experience. And if you got to see it on TV, hey, that's fantastic too. All right, taking a look here. Influenza or epidemic status for COVID, then influenza. It's growing slightly again in Kansas, and it is growing again in Texas. And when we come down to influenza epidemic status, it's growing in New York State, and it's likely growing up in North Dakota. A little bit more concerned about New York State because, again, you saw the traffic up there for the eclipse. There could be some spread. Maybe flu has a second wind once again, or a third wind at this point, because it already did have a second wind in some places. And when we take a look at variant data, JN.1, 86%, JN1.13, 10.8%, JN.1.18, 1.6% of the cases. New Jersey, not much to say about you. Only 60 out of 70 hospitals reported. 226 hospitalizations. I'm not even going to show the rest of the data because it's not worth it. Let's see if we had anything out of New York State today. New York State, 504 cases. I believe that's the same number from last week. Does not look like they updated. Let's see if the hospitalization number did complete last week. Hopefully it did. Let's see here. Hospitalizations in New York State. That did complete. 532 and 59 in the ICU. One thing we have to watch this week, yep, that's the statewide level. One thing we have to watch, will this be the week New York State goes below 500 hospitalizations? I hope it is. Stay tuned. We'll have updates, I think, for the rest of this week. Either tomorrow or Wednesday could be one of those out in the wild pandemic updates. Stay tuned. Probably more so Wednesday than tomorrow, but stay tuned. Of course, I'll let you know via Twitter. That does it for today's pandemic update. Hopefully you learned something here. Hopefully you got to see that, yeah, the eclipse could lead to some spread. And if you got to see the eclipse, once again, I'm not trying to downplay the memorable experience you had. Congratulations on seeing that. Hopefully you did so safely. And if anyone is sick out there right now, I hope you feel better soon. If it's COVID, I hope you get over it real quickly with no long COVID issues. I will see you all again next time. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe down below. It's the best way to help keep yourself safe and informed. If you know anyone that needs to see these videos, by all means, share this with anyone you know. If you saw the eclipse, leave a comment down below. If you have anything else to say, just leave a comment down below. I'll see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Monday evening. Thanks for watching.